Hi, my name is Sushima, and we are going to talk today about the influenza vaccine in pregnancy. So, is an influenza vaccine necessary in pregnancy or is it not necessary? When I was pregnant back in 1981, doctors specifically told me no vaccines, absolutely no vaccines of any sort in pregnancy. Sometime in the interim, vaccines started being recommended in the last trimester of pregnancy. Then they moved to the second trimester of pregnancy. And finally, they moved to the first trimester of pregnancy. And so the question you have to ask yourself is, why did these guidelines change? Did influenza suddenly become a deadly disease? Were women dying of the flu or losing their babies because of the flu in the, say, the flu pandemic or in earlier years when flu was rampant? No, it turns out the flu virus does not cross the placental barrier, but mercury does. Note that the flu virus does not cross the placental barrier, but the thimerosal, the mercury in the thimerosal, which is used as a preservative in the multi-dose vial, does. The vaccine is made by taking certain flu viruses out of, the 200 odd plus, or, literally hundreds of strains of flu virus that might occur in the next season. They can take at most one or two or three of these. These are ground up. In very simple terms, these are ground up. Their proteins are taken, and they before that happens, the viruses are grown on chicken DNA. And it is no coincidence that a lot of children today are severely allergic to anything chicken, anything egg. These vaccines are propagated on chicken embryos, eggs, and so on. And many methods are used to inactivate these viruses, and a lot of antibiotics and other killing agents are added to this soup, so to speak. So the virus is then killed off if it's an inactivated virus, and the hope is that the body will launch a reaction to the antigen or the protein presenting on bits of that virus, so you won't actually get the disease, but your body will make the antibodies to it. And the question again is influenza in pregnancy. What does it actually mean? Are women more at risk? The ACIP's recent policy cites two papers to support the claim that influenza during pregnancy is more serious than at other times. One was a British study that compared maternal and neonatal outcomes in women who got the virus during the second and third trimesters of pregnancy with those of pregnant uninfected control. The problem was that only 11% of the 1,659 pregnant subjects actually had evidence of the illness, serological evidence of illness. So when you get sick in winter, only in a very small fraction of the cases is it a true influenza virus. It's a host of other bacterial, non-influenza viral diseases that people get, and a very small fraction is related to the flu. And rightfully, they found that only 11% of the pregnant women had actual flu, had any serological evidence of illness, meaning it could have just been anything else. And none of them had detectable influenza A specific IgM, for which we have the vaccines. There was also no evidence of transplacental transmission of the flu virus or autoantibody production in the influenza complicated pregnancies. So, in other words, the influenza infection had almost no significant impact on the labor outcomes or the health of the newborns or maternal well-being. And then the authors claim that the complications in pregnant women with influenza infections occur more frequently than in the controls. But turns out no individual complication had any kind of statistical significance in these studies. And many of the listed complications appear to be subjective complaints, such as chest pain after taking medication, rather than specific diagnoses that hurt or harmed these women. There's only one recorded case of pneumonia during pregnancy, an uncommon but serious complication of influenza. All other complications lacked complete biological plausibility. So when you exclude these non-specific complications, there were really no significant differences between the two groups, the pregnant and the non-pregnant groups. They were not more at risk. The second study that was cited by the ACIP was one that reported that pregnant Medicaid eligible women in a Tennessee hospital registry had higher hospitalization rates during the flu season than their non-pregnant and postpartum counterparts, particularly during the third trimester of pregnancy. Well, guess what? Their hospitalization included hospitalization for delivery as well. Their hospitalization, as it turns out, was actually infrequent, ranging from 3.1 to 10,000 women months in the first trimester, and the study failed to discover a greater incidence of specific adverse events, including death during pregnancies. The other factors that limited this study were that the Medicaid population is known to have more risk factors and receive less adequate patient care than others of different economic means. The hospitalization rate was overestimated by the inclusion of admissions for delivery. Of course, all these women were hospitalized for their deliveries. The reasons for the admission were never quantified and included a broad range of non-influenza type codes. And aside from the event of hospital admission per se, there is no other big difference in morbidity or mortality. So there's a lot of fakeness in citing various studies to show how deadly and dangerous the flu is and how protective the flu vaccine is. Now let's talk a little bit about the flu seasons. I am reading here from a study by David Ayub, who looked at 1, 2, 3, 4, 5 flu seasons. And in each flu season, the CDC comes up with what percentage of the population actually had the flu. Guess what? In the 2004 and 5 flu season, 4 or 5 flu season, only 15% of the population actually had the flu. And out of that 15%, only 40% had a match against that flu, which means the maximum effectiveness of that flu shot was 6%. So in order to have it be effective with 6% of the population, you're talking about injecting 100% of the population with something that has a lot of other side effects. In the 2003 and 4, only 18% of the population actually tested positive for the flu virus, out of which the exact match was only for 11%, so it was only 2% effective. This year as well, the flu shot just was not effective. So in other words, the flu shot is ineffective most of the time, but it's an extraordinarily poisonous vaccine. And now let us talk about vaccines in pregnancy. There was one study by a fellow by the name of Heinonen and related to vaccine safety. And it is actually a lot of damage cited in that study that nobody talks about. The ACIP talks about the safety of the flu vaccine for pregnant women by saying that one study of the influenza vaccination on 2,000 women demonstrated no adverse fetal effects associated with the flu vaccine. But this study had very little to do with the safety of influenza vaccine. The reported outcomes were strictly limited to malignancies, mostly after polio vaccination during pregnancy. But there are other studies, the study's other findings are very important and very alarming. Among 18,242 women who received the inactivated polio virus, the malignancy rate among the 1-year-old children that they had was nearly twice that of the unvaccinated group. So women that were vaccinated with the IPV, their children, 1-year-old children, had 7.6 versus the 3.9% malignancy in the unvaccinated counterparts.